A vaginal yeast infection, also known as vaginal candidiasis, is a common fungal infection that affects many women at some point in their lives. It's caused by an overgrowth of Candida, a type of fungus that is a normal vaginal flora. The vagina has its own ecosystem of microorganisms, including bacteria and yeast. Lactobacilli is a type of bacteria that plays a significant role in maintaining a balance among these microorganisms to maintain a healthy environment in the vagina. Lactobacilli produces lactic acid and hydrogen peroxide to create an acidic environment that inhibits the growth of Candida in the vagina. The vagina has an acidic pH around 3.8 to 4.5 due to the presence of the beneficial bacteria, lactobacilli. This acidic environment is unfavorable for the growth of many harmful microorganisms, including Candida albicans, helping to keep its population in check. However, certain factors can disrupt this balance, leading to an overgrowth of the fungus Candida or yeast. Changes in hormone balance or levels during menstrual cycle, pregnancy, times of taking birth control pills, or menopause, can influence the vaginal environment, disrupting the balance of microorganisms and potentially causing yeast or Candida overgrowth. Antibiotics can kill off beneficial bacteria, disrupting the balance in the vagina, creating a conducive environment for yeast overgrowth. Weakened immune system can also influence the overgrowth of Candida. HIV, AIDS or chemotherapy can compromise the immune system, reducing the body's ability to control Candida growth. Uncontrolled diabetes can make a person more susceptible to yeast infections, as high blood sugar provides an ideal environment for yeast to thrive. Symptoms of vaginal yeast infections may include intense and persistent itching of the vulva, burning sensation, especially during urination or intercourse, redness and swelling around the vulva and vaginal area, thick, white discharge resembling cottage cheese. If experiencing symptoms of a yeast infection for the first time and symptoms are severe, or if experiencing recurrent infections, it's important to consult a healthcare provider for proper diagnosis and treatment. Consulting a healthcare provider is crucial for timely and accurate diagnosis. They may conduct a pelvic exam and take a sample of vaginal discharge for laboratory analysis to confirm the presence of yeast. Treatment typically involves antifungal medications, available in various forms like creams, ointments, suppositories, or oral tablets. Over-the-counter, OTC, options are available, but severe or recurrent infections may require prescription-strength medication. To prevent vaginal yeast infection or persistent reinfections, maintain proper hygiene by keeping the vaginal area clean and dry. Change underwear immediately when they are wet. Wear breathable or cotton underwear and avoid tight-fitting moisture-trapping or moisture-producing underwear. Avoid use of scented products or deodorants that could disrupt the natural balance of the vagina. Avoid overwashing the vagina or douching, it disrupts the natural balance of the vaginal environment. Use water-based lubricants during sex when necessary. Limit antibiotic use by only taking antibiotics when necessary and prescribed. Yeast infection or vaginal candidiasis is not a sexually transmitted infection. However, itching and scratching can cause breaks and tears, increasing the risk for STIs. Therefore, practice safe sex by using condoms to prevent contracting sexually transmitted infections. Eating a balanced diet, and managing underlying health conditions, can also support the body's natural mechanisms for controlling vaginal Candida and preventing overgrowth. While vaginal yeast infections are common and usually not serious, proper diagnosis and treatment are essential for effective management and to rule out other potential issues. Always consult a healthcare professional for personalized guidance and treatment options. Thanks for watching.